Should I take enclomiphene with TRT? TRT being testosterone replacement therapy. I think it's a great question because what happens when you put the gas pedal and the brakes on at the same time? Now, this question about taking enclomiphene with TRT is a question we get all the time at Ageless Future. And I can tell you that it sounds like a simple question, but the answer reveals one of the most important and most misunderstood dynamics in male hormone optimization. In this video, we're going to deconstruct the difference between enclomiphene, testosterone, the pathways it works on, and I'll also give you some insights on what may be a more viable asset when it comes to longevity. So I'm Regan Archibald, founder of Ageless Future. I'm the author of the book, The Peptide Blueprint. Pick it up. It will give you a good screenshot of what you can do when it comes to building a program and a protocol around peptides. Can you take these two compounds together? Well, it makes sense in a clinical perspective because when you take testosterone replacement therapy, now you block the feedback loop, your body stops producing it. And so ideally, you want to keep your body producing some testosterone on its own. The other thing that happens when you take testosterone, you turn off this process called spermatogenesis. Now, I want you to have lots of kids, lots of babies. We need healthy sperm. Men and infertility rates, both in men and women, are higher than they've ever been. And it's a real problem. It could be a disaster for future generations. So we do want to protect your testicular health. And so the problem is this TRT side effect is when your testes stop working, now you're going to have this issue where you're dependent on testosterone. When you think of these men's health clinics, these drive-by testosterone clinics, testosterone is phenomenal. It's more risky to not be on testosterone than to be on it. So nothing wrong with that. But one thing that happens is when you take a synthetic version, usually it's testosterone cypionate or propionate, and yes, it's trying to mimic the bioidentity of your testosterone. But when you flood your body with this hormone, your brain recognizes it, and then it shuts down your own production. The luteinizing hormone and follicular stimulating hormones, they drop to near zero. Your testes, they don't have the signal. They begin to atrophy and shrink. They stop functioning. You become infertile, don't even realize it. Maybe you say, oh, that's an acceptable trade-off. But when I talk to men every single week who've been on testosterone replacement therapy, maybe 5, 8, 10 years, and they started when they're 30, now they've got that significant other. They say, well, I want to start a family. Can I get my testes working again? Or is there another way? And so that's where enclomiphene comes in. So enclomiphene is a SERM. It's a selective estrogen receptor modulator. While testosterone is just an external source of the hormone, your brain sees it and puts the brakes on what's called the HPG axis, your hypogonadal pituitary axis, and production of sperm ceases. And enclomiphene, it works in the opposite direction. It blocks the estrogen receptors in the hypothalamus and removes the negative feedback and stimulates luteinizing and follicular stimulating hormone production. Now, this drives your natural testosterone production from the testes. So these are opposing signals. So if you think about giving them both simultaneously, there's a tension. You're pressing the gas and the brake at the same time. So here's what the studies show. So in a landmark 2015 phase 2b trial, I referenced this in our last video on enclomiphene, there's 124 hypogonadal men, so low testosterone, randomized to enclomiphene, testosterone gel, or placebo. The data was unambiguous. Men in the enclomiphene groups maintained spermatogenesis throughout the 16-week study, and they also had almost a doubling of their testosterone. These men had testosterone levels below 250. Men on the testosterone gel saw luteinizing and follicular stimulating suppression to near zero, and the reproductive axis went dark. This is not a minor side effect. It's a fundamental structural change to your hormone biology. And then you look at the hematocrit, and their blood became stickier because testosterone pulls red blood cells from the bone marrow. So a 2025 meta-analysis from the Federal University of Santa Catarina, what they found is looking at 10 random controlled trials, 819 patients, they confirmed SERM therapy demonstrated significant improvement in sperm concentration parameters compared to the testosterone gel. The men who used a SERM like enclomiphene preserved their reproduction capacity. The men on TRT did not. So when does combining them make sense? Well, sometimes in Enclomiphene, we found about 15% of you, even with Enclomiphene and getting all the healthy lifestyle in, your testosterone shot. We just can't get it to that optimal level. And so there is a place to use Enclomiphene alongside with TRT. And especially anyone using TRT, we are aiming to preserve your luteinizing and follicular stimulating hormone activity. Now, that keeps your testes from fully atrophying. Particularly, we do this, we're very cautious in men who want to maintain fertility potential while still getting a full benefit from testosterone therapy. Now, it's a very nuanced, individualized protocol, but even if you're thinking Enclomiphene, you're on testosterone, and you don't want to have babies, you still want your testes to work. And so this is where ganadorelin, you can cycle Enclomiphene, ganadorelin, kispectin. Ganadorelin, kispectin also work on the luteinizing and follicular stimulating hormone pathways. But it does require a provider who understands it's not just the signal, but it's also about how can we just optimize what's going on in the body based on where you're at in life. And so it's different than just getting handed a testosterone prescription, getting it filled, injecting yourself. I think Enclomiphene is a great restart protocol for cycling off TRT. I love TRT, but you do not want to be on it long term. You want to cycle on, cycle off. Otherwise, you're suppressing the signaling in your body. And Ageless Future, we're absolutely dedicated to improving the signaling in your body. So here's the insight. If you have testosterone between 250 and 400 nanograms per deciliter, but you still have a functional HPG axis, Enclomiphene as a standalone therapy, it might be superior to TRT. You can get the testosterone elevation, you can keep fertility, you keep the architecture, and it is available as a 503 compounded medication through pharmacies from a valid prescriber. Now, this is really important because with TRT, the question that many people ask too late, and we see this pattern at Ageless Future constantly, is men who've been on testosterone for years, sometimes more than a decade, who now want to have children, this production of their sperm is just completely turned off. And so the answer isn't, let's just keep going on TRT and hope it comes back. But Enclomiphene is a precision tool that you can rebuild that signaling in the testes where luteinizing hormone, follicular stimulating hormone can actually improve your fertility. So where do you start? Well, the first place you want to start is with your lab biomarkers. Yes, you can do sperm testing. That's important. Finding a fertility doctor if this is a big goal of yours. But before you do anything with your testosterone, just because you have low libido, you're stressed, I see men all the time that have great levels of testosterone and they have no libido. Testosterone has a small portion of it. It's really the stress in the nervous system that has a big impact. But what you want to look at in your labs is your total testosterone, your free testosterone, your luteinizing, follicular stimulating hormone, your estradiol, your sex hormone binding globulin, and then look at your liver function, your ALT, your AST. What's your Boone look like, your creatinine levels? What's your lifestyle like? How often are you eating plastics? What kind of processed foods are you eating? That all deteriorates your testosterone. And if you got metabolic disease, get it fixed. And all you need to do is go to agelessfuture.com, schedule a free intro session with one of our health ascension specialists, find out if you're a right fit for one of our programs. We have 4 different programs. We have our Limitless, our Ultimate, we have our Accelerator, and then we have the Activator. But you won't regret it because your health is your most valuable asset. And so if you love this video, you want to go deeper on Enclomiphene, then check out my next video. Does Enclomiphene increase muscle mass? We'll provide a link in the show notes. Make sure you subscribe. Leave us a comment below on whether you like TRT or Enclomiphene better. I'm Regan Archibald. I'll see you in the next video.